This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222.
How much is a consult on Zoom? She's not in Sydney. And do you have any doctors who can do my entire treatment from conception to delivery?
Yes, I do. So two of our doctors at Life Fertility do obstetrics and deliver babies. Obviously, that's in Sydney. We can't do that by Zoom. In terms of talking to me and going through the cycle, my initial consult, if it involves both you and your husband, is $200, or partner, is $370. And in terms of if we then decided that IVF was what you wanted, almost no matter where you are in Australia, we can manage it at where you are right up to the day before egg collection. And you'd have to come to Sydney for the egg collection, but we have arrangements with multiple ultrasound people and blood pathology groups around Australia to look after them. I've had women from, in fact, as far away as Hong Kong coming in on the day before the egg collection and been successful. So it's all possible.
And Prof, for people outside of Sydney but based in Australia, a lot of this can be also claimed on things like Medicare, right?
Oh yeah, so of the $370, you'll get back about $160 of that on Medicare.
So Prof, Saleh says, can I please book? I want to have a bit of a chat with you, I'm assuming that means, with you guys, please. I'm located in Queensland.
Yep, no problem at all. You've got the number there.
Yeah, I've just pasted all the details again into the chat. I've done that 2 or 3 times now.
Right. Okay, so if you ring my secretary on that number and make it an appointment, I can do a Zoom with you anytime. Not anytime, but I consult on Monday afternoons, Thursday mornings and Friday mornings.
Prof, just confirming the number is 0291384222.
Yes.
And the email address is m.chapman@unsw.edu.au.
Yes.
The website is lifefertilitysydney.com.au.
Correct.
Okay. Next question, Prof. What role does uterine environment, lining, receptivity, and immune factors play in IVF success?
Huge debating area. There are some that believe and some that don't. I don't believe it, mostly. There is a condition called antiphospholipid syndrome, which can ultimately end up with a disease called lupus. And there is good evidence that miscarriage rates in particular, 50% higher than if you don't have it. So working backwards, one might suspect that this immune abnormality may produce a failure of implantation if it causes failure of the pregnancy once it's established. All the other immune testing, and I mean there are practitioners, some of them I'd call colleagues of mine, who do multiple immune testing, like 25 different immune tests. And the sad thing about testing is not accurate. It produces a normal range, but outside the normal range, there are lots of normal people as well. But as soon as you go outside of the range in one test, because the statistics for those individual tests is that there's a 1 in 20 risk that you'll be normal, even though the result comes back as abnormal. So if you do 20 tests, you'll find one abnormal, and these guys will tell you that you need to have immune therapy. There are no randomized controlled trials that suggest that any of these immune therapies make any difference to pregnancy rates. The problem is that if you do an IVF cycle and you fail, and the odds are next time you've got a 30% chance of a pregnancy. So if you get pregnant next time and you've taken the immune therapy will get the credit. But actually, it was just the randomness of getting pregnant with IVF. So to prove that those treatments work, you'd have to prove that next cycle was more than the background 30% rate. and they've never done it. So I'm not convinced that there's any value in any of these treatments other than to satisfy what people read on ChatGPT and others. And we are not convinced that any of those make any difference whatsoever.
Prof, we have a question from Sally again. She says, I haven't seen my period for 2 months. Now, I don't know what is the cause.
Okay, you need to go to your GP to get some blood tests done, or alternatively have a consult with me, and I would arrange blood tests depending on your age. I mean, women missing periods, stress in itself can cause that, and if you're trying to get pregnant and you're not getting pregnant, that can be enough to stop your periods. Obviously, other things we need to be concerned about: abnormalities of your hormones, heading towards menopause, polycystic ovarian syndrome. There are multiple reasons why you've missed a period. Most of them aren't necessarily to worry about, but you need to know the answer. And if you're trying to get pregnant, you certainly need to have periods because they say that you've ovulated.
Well, Sally says thanks. She says she's 33 years old.
Yeah, well, it shouldn't be menopause. There are other things going on. Happy to have a more detailed consultation and do the appropriate investigations.
I think she's seen the contact details, but just in case, I've just posted it once more in the chat. I think we have time for one more question, Prof. When a cycle fails, how do you decide whether to change the protocol, change the lab, or simply try again?
Unfortunately, I see too many patients for second opinions where a doctor who's not necessarily had the training that we believe amongst the subspecialists in our speciality, they haven't had the training. And so what they do is follow a recipe. And the clinic that they work with in between their obstetric consultations and their gynae operating, they just let it run, and they'll do the same thing again and again and again. I've just seen that far too often. What needs to happen is for the doctor to sit down and go through the cycle in some detail, see whether there can be modifications that might be helpful, adding a little bit of LH or using a different medication. And the evidence is, in fact, that most medications, the FSH that we give you, really there's no difference between them. But I still have a view that potentially for some women, one medication might be better than another. And then getting the day of trigger, deciding how big the follicle should be before you, and what the estrogen level should be before you have the egg collection is actually quite a detailed conversation and requires a bit of thought. If it didn't work last time, what would we do? Would we wait a little bit longer? Would we go a little bit sooner? And you need people who had great experience to actually be handling that to get the best result for you.
And don't forget that you can access all the previous episodes by going to our website www.theivfjourney.com and select IVF Journey podcast from the navigation menu.